Thank you for attending Extend Health presentation to Xcel Energy's retirees for their healthcare benefits for 2013 and beyond. My name is Colin McLennan. I'm a benefit advisor at Extend Health. Who is Extend Health? We are an independent company dedicated to serving Medicare-eligible retirees just like you. We've partnered with over 80 health plan carriers to provide you coverage to fit your individual needs and your individual budget. The U.S.-based benefit advisors that you will be working with are trustworthy and objective in helping you find new coverage for 2013. Our primary goal and focus is on helping each participant make an informed and confident decision at no cost to you. Extend Health has conducted this transition for several 100,000 retirees over the last several years. We've done this for companies that you know and are familiar with: Ford, GM, Caterpillar, FedEx, Union Pacific. These companies trust Extend Health just like Xcel Energy is trusting Extend Health today. Beginning in 2013, your coverage is changing. At the end of December, on December 31st, 2012, your group plan provided previously by Xcel Energy will no longer exist, meaning that you will work with a benefit advisor at Extend Health to find new coverage. Your primary coverage, Parts A and B of Medicare, will not change. Part A covers hospitalization, Part B covers your doctor's office visits, and that will remain your primary coverage. Here is what is changing. Your additional coverage will be changing. You will no longer have access to the group plan offered by Xcel Energy. Instead, you'll have the option to choose from two basic core options. Your first core option that you can choose from is a Medigap plan, also known as a Medicare supplement plan, and you would couple that with a Part D prescription drug plan. That's your first basic core option. Your second core option is to look at a Medicare Advantage plan with the prescription drug plan built in. Those are your two basic core options, and we're going to jump into some more detail here in a minute on how those plans work for you. Additionally, if you're interested in dental or vision coverage, please talk to your benefit advisor about those plans. We have a variety of different plans on our exchange, and we're happy to discuss those with you. Let's backtrack and take a closer look at that first basic core option that I talked about, that Medigap or Medicare supplement plan along with a Part D prescription drug plan. The Medigap or Medicare supplement plan fills in the gaps that original Medicare Parts A and B leave out. So it helps pay the difference between your costs and the amount that original Medicare pays for. So things like deductibles, co-payments, co-insurance amounts. Those are some of the things that a Medigap plan will help pay for. These plans provide additional coverage for your doctor's office visits and hospital stays, as well as other expenses not covered by original Medicare. These plans are fantastic because they are not network-based plans. So long as your doctor or hospital accepts original Medicare, they will accept a Medigap policy. Typically, the Medigap policies have a higher monthly premium, but you don't generally have any out-of-pocket expenses when you go to the doctor or when you go to the hospital. Because the Medigap policy does not cover prescription drugs, it's going to be the benefit advisor's job to help you find a Part D drug plan that's going to cover your prescription drug expenses. And to reiterate here, a Part D plan supplements Medigap plans to provide you prescription drug coverage. These plans help you pay for your prescription drug expenses. We'll talk about that more in a minute here as well. One important note is that you will need to pay for your first premium when you enroll in coverage. The benefit advisors are going to help you select a plan. We'll walk you through the enrollment process, but you will need to pay your first premium when you enroll in that coverage. Your second core option for 2013 are what are known as Medicare Advantage plans with prescription drug coverage, or MAPD. An MAPD plan provides you an all-in-one plan which bundles your Part A, Part B, and Part D prescription drug expenses all together with additional benefits. So again, Part A is your hospital, Part B is your doctor's office visits, Part D are your prescription drugs. These MAPD plans provide coverage for your doctor visits, hospital stays, and prescription drug expenses. They are network-based plans, meaning they are HMO or PPO type plans. The benefit advisor that you work with is going to work closely with you to make sure that your doctors and hospitals accept a Medicare Advantage plan should the two of us decide that it's the right plan for you given your individual needs. Typically, these plans have a lower monthly plan premium than a Medigap plan. However, you do have out-of-pocket expenses with these plans. You'll have copayments when you go to the doctor generally, copayments when you're in the hospital. We'll talk more about that in a moment.